paper is about role of OCT angiography in predicting the leaks in central serous retinopathy. As we all know, central serous retinopathy is caused by choroidal vascular dysfunction, most commonly seen in middle-aged males. It has a higher incidence in Asians, Caucasians, and Hispanics. And we have a variety of investigations like fluorescein angiography, indocyanine green angiography, OCT. But invasive methods have their own limitations. So our aim of the study is to analyze the feasibility of optical coherence tomography angiography as an effective non-invasive modality for predicting leaks in CSER. So this is a retrospective study done at our hospital in Trichy. It was from September 2022 to 2023. Newly diagnosed treatment naive and previously treated CSER cases were included in our study, and patients who had previous vitreoretinal surgery and subretinal fibrosis and patients who had history of uveitis were excluded from our study, and the mean follow-up was about 3 months. And best corrected visual acuity, intraocular pressure at the baseline and 3 months, and dilated fundus examination were done. Imaging included fundus fluorescein angiography, spectral domain OCT was done, and OCT angiography. We analyzed the choriocapillaris layer using TopCon DRI OCT. So about 60 patients were included in our study, and 25 patients were our chronic CSER. And in fundus fluorescein angiography, 25 patients had leaks, of which 68% of the patients had parafoveal ink blot leaks, and smokestack leaks were parafoveal in 16%, and 12% patients had juxtafoveal window defects. And in OCTA, in the choriocapillaris layer, we can see black spots in most of the cases. There are also high flow areas noted within the 68% of the cases within the dark spots, and we are able to find pigment epithelial detachments corresponding to the dark spots in about 68% of the cases. However, one case had no leak on fluorescein angiography and had a dark spot on OCT angiography, and 3 cases had a leak on fundus fluorescein angiography with no dark spots on the OCT angiography. So coming to the imaging, we can see the ink blot leak on the fundus fluorescein angiography, and there are bridging retinal process in the OCT angiography. We can see the flow void areas, but we were not able to correlate with the leaks initially. So we further analyzed the images, and we found some flow intensity signals were found within that of the flow void areas. And we termed it as, it was previously described by Estavro et al. As choriocapillaris island. So coming to discussion, OCTA provides valuable insights into our CSER pathogenesis. This hyporeflective areas on the choriocapillaris imaging correlated mostly to the pigment epithelial detachment in our study. Flow voids were also observed in both acute as well as in chronic CSER. OCTA can also be useful in differentiating the patterns of choroidal neovascular membranes, and this choriocapillaris island is a OCTA finding which is found in our study. That is, there is increased signal intensities in choriocapillaris layer within the flow voids, and it actually corresponded with the focal leaks on the FA. So flow voids can be flow voids can be derived by the sluggish flow of the choriocapillaris. It may be due to mechanical compression by the related large choroidal vessels, and there may be an underlying shielding effect of the underlying retina with false flow impairment, and it can be seen. And Zhang et al. Proposed that the side walls of the detached retina and pigment epithelial detachment can further contribute to signal attenuation, and they suggested swept source OCT for a better delineation of the flow signals. Our study has a number of limitations, being retrospective in nature, and it had limited follow-up of only 3 months, and we didn't do manual segmentation, and the FA details was not available for all patients. Lack of ICGA for further validation, and swept source OCT was not used in our study. We had used only spectral domain OCT. Fellow analysis was not included in our study. So to conclude, OCTA is a valuable non-invasive tool for diagnosing and monitoring CSER. Choriocapillaris island is a valid finding, and it can predict the evolution of choroidal neovascular membrane and potential leaks. But however, fundus fluorescein angiography is the gold standard in predicting the leaks. This finding can be used to predict leaks in patients who are not able to undergo FFA. These are my references. Thank you.
You yourself said, yeah. So as you yourself said that FA still remains the gold standard in this situation. Because for one situation that comes to my mind, so what would your opinion be? The question is that on the basis of the pinpoint leakage in FA, we can do focal photofomentation laser.
Yes, sir.
Of course, nowadays micropulse laser is also available, but traditionally green laser can also be done. Focal photofomentation,
Yes,
not a photocoagulation, photofomentation. But you can't do that using OCTA.
We have thought of using a non-invasive modality for patients who are not able to undergo.
Yeah, that's it.
Because we are having more false positive and also false negative are also seen in our cases, sir.
Did you do laser based on your Octa finding?
No, sir. I wouldn't do.
Thank you so much.
Would just like to ask the panelists as to are you routinely doing angiography in the CSR cases?
The free paper session actually
Right.
doesn't warrant discussion
Sure.
internally.
Sure,
So
maybe later.
let's move on to the next paper.
Sure, absolutely.
Yeah.